Good afternoon and welcome along to Destination Wellbeing. My guest this afternoon is Theresa McGarry, and Theresa and I will be talking all things ears, so an exciting programme ahead for today on a topic that, to be honest, we haven't covered, so it's great to have Theresa here to chat to me about ears and how we can look after them and preventing hearing loss and all those types of things. But just to remind you at the start of our show, if you do have any concerns about your own health and well-being, that you contact your GP as your first port of call and get them to check out that your own health and well-being and the health and well-being of any children and that as well. So Theresa, you're very welcome. Thank you for joining me today. So just tell me, I know we were chatting briefly before we come onto the camera and I got to get an idea of your background, but tell me, we can go over that one again just for our audience this afternoon. So
I'm a near care nurse. I am trained in near care in the past 15 years, and up until December 2014 I worked in ENT in Daisy Hill Hospital, and that's where I got a lot of my knowledge and skills, and I then retired, felt I wasn't ready for the scrap heap, and have taken on this new concept of going out into the community and working with ears and generally going out into people's homes and trying to raise the awareness of ears and ear problems.
Okay. But yeah, I mean, just until we chatted today, it was an area that, whilst it's so important, and I mean, to not have our hearing is as debilitating as not to have your eyesight or not to have it's something there, but it's not something that we generally take a prevention's better than cure approach to. So we go to the dentist regularly to get checked up. We do regularly get our eye tests done, but here we kind of just let it be there until it's not and then start to worry about it. Would that be your
That is
experience?
Generally the take on it, and our hearing is very important for us to just live a normal life and have good social skills. You need to have your hearing. You can hear very well with one ear, or some people can hear well if they have hearing aids. But it's important, if we have some problems with our ears, that we take the first steps. Either if you have blocked ears, itchy ears, you could go and see your pharmacist and they could offer you some softeners, or go to your GP, your practice nurse, or you could come and see me.
Yeah, it's and we're all, I mean, I know I certainly growing up was always told not to put anything smaller than your elbow in your ear, and I think that's a piece of advice a lot of people get. Whether we all heed it or not could be another story. So, and is that how it should be? I mean,
yes, that is very true, Joanne. Nothing smaller than your elbow. We all have wax in our ears, and wax is very normal, and it usually sits at the entrance of the ear or just slightly down the ear canal. It's a preventative for infections, and also can help prevent foreign bodies going into the ear. When we say about ears and the cleaning of ears are self-cleaning, but a lot of people love to put in such things as matchsticks, cotton wool buds, and often the cotton wool bud head is left and lodged in the ear, and therefore causes a loss of hearing temporarily. And when they do that, they push it further down into the drum. Mm-hmm. Some people find a loss, muffled hearing, or get quite a loss. Again, as I said to you, you can resolve it by sometimes using softener, or if that doesn't work, to go to your practice nurse, your GP, or you can come and see me.
Yeah, and get and that would be then obviously a deeper treatment that would need to be done. So what would be and this question's only kind of just come into my head now. So when we talk about the eardrum, what kind of size are we talking? What kind of distance is that from sort of the outside of our ear that we would be familiar with? How far down does it go in?
It would only be about 0.2 millimetre, well, at the most. The ear canal is small. The ear is broken up, Joanne, into three parts. The outer aspect, the middle, and the inner. Mm-hmm. And the outer aspect is where you can wipe round and clean, and that actually is where the hearing first in the pin eye is converted down into the ear canal. And the next section is the ear canal where the wax is, and then in the inside of the ear is where the balance, and that is,
and that's which would be affected if someone was suffering with vertigo and that type of thing.
Vertigo or anything tinnitus, or lots of things.
Yeah,
You know,
there's so many different.
Yeah. The ear is very complex, and it's not to be played around with.
Well, it's
you
like
know.
it's like the human body in general, isn't it? I mean, it's
Yeah.
such a complex. We really only scrape
Tip
the
the eye,
surface
yeah.
whenever we even begin to understand it. Even when we do understand what's going on, because it's it's amazing all of the time. And as you say, you know, earwax is there to kind of prevent infection and things like that, and that would be similar to other mucousy parts of the body, where the nose there is there to filter out, and the hairs in our nose are there to filter out. So generally, where we have an opening into the body,
Yeah.
we'll have some form of substance or something there to prevent it. Obviously, the same in the genital area and stuff like that as
Yeah.
well, where there's we're designed to keep things out. Which is fascinating when we think about it, how finely tuned and designed the body really is. And so you mentioned about this idea of maybe the new business that you've started since retirement, and I love that idea, not ready for the scrap heap yet, because I think that so many women work their entire lives and they've so many skills and so much knowledge that they can share with other people, and then they get to an age and maybe it's not the normal run-of-the-mill work that they want to be doing, but they still want to be playing a role and having an impact. So
yeah, that is important in life. You know, I was used to structure for 38 years. While I was in Daisy Hill as well, I was also a clinical sister, and ears was my specialty, and I felt that I had something more to offer to our community as regards ear care. Daisy Hill is great. It's one of the best suites in Ireland with the best consultants.
yes, because you mentioned you were involved in the opening of the first nurse-led
Clinics,
clinic.
yeah, that would be correct. Back in 2006, it would have been around 2003, I actually got my ear care diploma, and it was obtained in Rotherham. And I come back, and under the guidance of Mr. Ted McNaboe and Mr. Peter Layden, who were the only two ENT consultants at the time, they encouraged me to take the next step and open up nurse-led clinics. And those are still running and are very successful in Daisy Hill.
Yeah. And I mean, that idea, I think we can often knock our health service, and we often talk about what we don't have, but I was completely oblivious to the fact that we have in Daisy Hill here in the Southern Trust area, that we have one of the best facilities for ears in Ireland. I mean, and it's unfortunate because those are the sort of things that we should be talking about. Those are the type of things that the public should know. Yes, it's important maybe to talk about where things aren't working exactly as they should, but to know that, and I would consider myself fairly clued into what's going on locally, but that was complete news to me. So what is it they say? Every day is a school day, and we learn something new every day, and we're always learning. And so as you say, it's now the opportunities there for you now to be mobile, to go out to people at, I'm guessing, kind of times that suit them as well.
Yes, it's all geared towards while I still refer to them as being the patient. I don't like the word client. They would all be patients, and therefore when it suits them and how I can get out to them and deliver my
when
care.
It works, which is just at Christmas time, I know a lady who was at the hairdresser's and got some water in her ear, and I know a lot of hairdressers, and this one in particular was also very careful, but these things still happen, that sometimes when the head's tilted back, it's quite an easy access point for water to get in, and obviously it was a difficult it was a busy time coming up to Christmas and everything else, and you kind of let things go, but then there was the concern that it was the water was coming out for too long, and there may have been an infection and stuff there. So what type of things would somebody be looking for in that case? It was then also discovered that there was a lot of wax in the other ear, so it's...
Well, my take on that would be that you would have your ears examined, as I say, either by your GP, practice nurse or myself, and you would look and see if the person had wax in the ear, and the water could have pushed, the force of the water could push wax further down into the ear, and that would have led to muffled hearing. Sometimes it can cause infection, and no doubt that lady may have got drops, and drops are great. They're softeners. Could be olive oil. Could be something given by the pharmacist. Could be something given by the GP. But it's important that people know how to put drops in. This is like teaching your granny how to suck eggs.
Yeah,
but anyway.
But so many people don't know
No.
it, and if they go in, you know, we might as well do something right as not do. You know,
Yeah,
you'd
well,
be as well not doing it as not doing it right. So.
Yes. Lifting the ear upwards and outwards is a way of doing it, because you can see down into the canal, and you should only put 2 drops down in, and you should rub with the pulp of your finger on the tragus of your ear.
Okay,
and
so
that
we're
helps.
Kind of talk in this area here.
Yeah, the tragus.
Okay, this is the tragus. So, and when you say lift it up and out, we're going this
From
kind
the
of
top,
direction, from the top
up and
up
out.
and out. Okay.
And the other way is if they're lying down, is also a good way to put in eardrops, and ask them to remain lying for 10 minutes. A lot of people are inclined to put cotton wool straight into the ear after they've put the eardrops in. No cotton wool, because that's only absorbing whatever you've put into the ear.
We're only talking, as you say, you're only talking such a small area, so that as soon as something goes in that's going to be absorbent, it's going to remove that, really. And I know a very common, again, sort of picking it up, probably around Christmas time. Hopefully, I think it has passed. But there seem to be, maybe into early January, there seem to be a lot of ear infections going about in children. And I know we briefly mentioned just in terms of hearing problems in children or ear infections and things like that, because they're...
Yeah, children are more prone to infection, and with mixing in large groups of children, you are going to get these infections, whether it be ears or whatever. Ear infections should be treated again by a specialist nurse looking at them, or the GP. And sometimes the problem that comes up with recurrent ear infections is where the child may warrant vents and have a loss of hearing, and that would be seen in the GP, and he would then refer them on into the ENT department in Daisy Hill, and there's where it would be seen as glue ear.
Okay.
And they used to put the vents in quite quickly, but now they have decided that it's better to watch and wait, because the level of their hearing has gone down. And as you said, it could be infection. Yes, it could be due to a chest infection or sore throat, because the ear runs with the eustachian tube down into the throat. If it's blocked, the air entry into the ear won't just be as good.
Yeah, and then if the I'm guessing then if the air entry is not right, then the sound doesn't work that way. Yeah. And it's one actually that always sticks in my head from a reflexology point of view, because you'd be working with the ears and the eyes, and the eustachian tube are all quite close reflex points. So it's, I suppose I was interested, as you said, it's sort of coming down this way. I, somewhere in my head, always thought that it went across, but it's I suppose because I'm working across the way. But yeah, so as you say, it's that watch and wait. There's no need for surgery if it's not necessary.
No.
But vents, it's quite, children recover from it fairly easily, and it's
they do. It's only a day procedure now.
It's only,
and the great thing about it is they go in the morning of their surgery, and prior to that they will have a hearing test carried out, and often their hearing test is normal, and they don't need to have the surgery, so they can be sent home again.
Yeah, just as quickly as they come in. Which is it's fantastic, and it's great. It's great reassurance there as well,
of course,
because I suspect that maybe in times gone by, things, as you say, were done quite quickly, and it was a reactive, reaction, and maybe still it could have sorted itself out, because we talked quite extensively on how amazing the human body really is in terms of figuring things out, and even the fact that temperatures rise slightly, and that helps the immune system. It's obviously monitored, but that whole idea of infections and how the body can fight them off. And then when it's needed, then the support as well. So, but ears are certainly a whole new area for me to be focused on. And so for some people at home, with that, as I said, we're talking about dentist appointments once every 6 months. Would there be an age that you would recommend getting ears checked more frequently, or is there anything that people can do to themselves, or how? It's a difficult one to do something with yourself, isn't it?
Well, yes, but for the first 40 years of our life, everything is great, and we don't go to have a checkup like the car. very rarely. We just live life to the full and we don't go for anything.
And we take
And
it all
then,
for granted.
suddenly, when we get over the age of 40, things start to go down the ways. Your hearing just mightn't be as clear. Your vision isn't as good. You may need glasses. But I wouldn't suggest at that age to really go about your ears as we get older. When we get maybe into our 60s or so,
Then
I would suggest, yes, you know, that you would go if you felt that you had muffled hearing or your hearing was not just as good as you thought it should be.
And sometimes maybe is it that it could be a gradual process and people don't realise how bad it is until it's really, you know, until it's really bad. Because if something's just getting a little bit less kind of over a period of time, you kind of notice a little bit less, but you don't really, if there was a huge impact, I mean, if I woke up tomorrow morning and there was a problem with my hearing, I'd notice that and I'd know that there was something needed to be done. But over maybe a longer period of time, it's less likely that we notice that, isn't it?
Yes, it is. And as you said, there's two, you know, you could have a sudden loss of hearing, which I would be suggesting you go straight to your GP and get that sorted out, or gradual loss of hearing. But when it becomes more evident, the gradual loss, it's time to do something about it. Yeah. We all have this idea, oh, we don't need to do anything, we imagine it. Yeah. But if you go and see to it, it's a big help in life.
It's and it is that, there's sometimes that acceptance that things won't be the same. Isn't, you know, it's kind of without realising, you know, we think, well, yeah, my eyesight will fade and my hearing will get, as I get older, all these things will happen. But it could be as simple as needing to get the wax that has maybe been residued or built up over a period of time removed, and maybe the body's just not as efficiently self-cleaning. As you get older, it may not be that there's actually any problem really with the hearing, it may be just that it's that. So it's that idea of kind of not just accepting things and going, if we do notice problems or issues with our health, then to not just say, oh, well, sure, that's just part of getting older type thing, that there could be something that could be done and you could have another 10 years of great hearing before you need to worry about it. And I think men get a hard time with this as well. So there's always the stereotype that women are much better at looking after themselves than men, but and ears is obviously something that affects men and women just as much, because I'm guessing even things like, you know, often there you'd see maybe even a man where he's been shaving and there's a bit of the shaving foam onto the surface of the ear and they maybe haven't noticed that there. So I'm presuming that those kind of particles or shower gel, shampoo, things like that can be finding their way around the ear area too.
Of course they can, yeah. And it's like people with skin disorders, maybe eczema or whatever, dry skin falls down into the ear, amalgamates with the wax, and therefore it becomes maybe hardened wax or gunge, and therefore reduced hearing as well. For people like that, I would be advising Vaseline to the outer aspect, all of the outer aspect, twice a day. It moisturises it. And also when you say that, swimming is another problem. When we go in swimming, we don't cover our ears, and it would be good to put earplugs. Let's face it, seawater and pool water are both really, really dirty. There's no other way of putting it, but they're both really dirty. So therefore, I would be suggesting big time that you put earplugs into the ears.
And I mean, we've, you know, obviously here in Uri, which has been fantastic, there's it's very strong upsurge in sports, people doing triathlons and swimming and all that kind of thing. So it's something that you would definitely recommend. And there's loads of different types of earplugs as far as I gather. There's
you can buy them, Joanne, in the sports shop, and you can go in and get them on the internet. Some of them come as like a putty, particularly ones on the internet I've seen, and you can mould them to fit your ear, which is sometimes better. Some people get them and they don't really fit their ear and they're serving no purpose. The other thing,
maybe causing more problems, because if the small bit of water's getting in at the side of the earplug, then you'd imagine that would be a problem.
Headbands. Headbands have become a big fashion in swimming, and you can put them over the whole head and also wear the earplugs at the same time.
And that'll just help reduce risk, really, isn't it? The other thing then, I would have known, my background would be food science, so a lot of the people that I would have went to college with and that would work in food production plants and would wear earplugs for noise regulation. So and that in itself can bring problems if the earplugs are being worn all day every day? I know they would have to get hearing checked quite often with that.
Yeah, and now in the workplace they've introduced that, particularly in noisy environments, they would have introduced audio. Mobile people go around and take hearing tests to see what their level of hearing is.
Yeah.
You know, for a while there was none of those things in the industry of any kind.
Yeah, and
Nothing.
obviously there's noise regulations
Of
and
course there is, yeah.
things like that as well. But I know one friend in particular who, interestingly, would have had problems with her ears, and she would possibly have vents and stuff in, and she would find it difficult to wear the earplugs all day because she would find the wax then would build up a lot more frequently. I don't know whether that's just a personal thing to her or something that's maybe commonly known.
Joanne, it's a bit like someone with a hearing aid. The wax can't extrude out it past it,
Yes.
so therefore it will gather and sometimes become very hard and difficult to remove. The like me could remove it maybe with ENT instrument or with softener again.
Yeah. So it's that importance, and I'm sure we've some factories and industrial areas here. So if anybody is in that position of maybe for a long part of their career where they're wearing earplugs on for maybe 7-8 hours a day, depending on the environment that they're in, it's an important one to keep an eye on and make sure that wax has a way of getting away, because I'm guessing that whole area, like any other part of the body, part of the whole self-cleaning bit is air getting in and doing different things. So if that can't happen, then there's going to be problems there, yeah, and moisture and all the other bits and pieces. So, well, thank you so much for joining me today, Theresa. It's been, I was going to say eye-opening, but maybe I should say ear-opening. And it's been, really, yeah, I've thought about things today that probably have never crossed my head. So it's great to get that insight, and it's fantastic to know that the service is there. And you're contactable and get through your website?
Through my website, yeah.
And remind me what your website is again?
Tad Earcare.
TadEarcare.com.
Yeah.
So that's TadEarcare.com, and for anybody with any concerns about their hearing, then definitely get in touch with either your GP, your practice nurse, or with Theresa, because the flexibility there to do evenings and weekend, everything.
It is, yeah.
Really, that's a big bonus as well. But definitely maybe as well to think about scheduling in a hearing test and just see what comes up there, because it's something that hopefully prevention can be better than cure as well. So, but thank you again for joining me, and it's been great to have you on. And thank you to our viewers for watching in. I'll be back in with Rowan on his morning programme on Thursday morning, and back on Destination Wellbeing next Tuesday.
So, you want local Newry and Mourne TV shows on your television? Which video box should you buy? Well, you have two options. Option 1 provides you as long as you have a good internet connection in your home, with all the programmes from destinationnewry.com, including
inside the fencing when we were up there. That's such a change. And the dog muck.
Destination Newry. Radio evolved.
Hello, your weather for today and tomorrow with Destination Newry today.
First, this is Newry News Bite.
Well, what's crack in Newry and Mourne today? We all had a great September weather-wise.
We're going to go straight into this show with a lively set of tunes from a band called
Well, good morning. Welcome to Destination Newry.
Tell me the provenance of that. Where did it come from?
Right there, and welcome back to the studio.
Good afternoon, and welcome along to Destination Wellbeing. My guest is...
Hi everyone, and welcome to this week's Newry's Loose Women with me.
Well, it's hello and welcome once again to the programme. My name is Tommy Sands.
And the pulse of the house of our God. Praise the Lord.
Philip Rogan, rather, wearing number 19.
Evening, everybody, and you're very welcome to Newry Showgrounds tonight again.
So that's option 1, and to choose this, click on option 1 below, or you can go to vario.ie and buy option 1. Option 2 provides you, as long as you have a good internet connection in your home, everything you get for option 1, including all the programmes from destinationnewry.com, Plus, you will be able to add over 1,000 private or public channels at the touch of a button, most of which are free. So that's option 2. To buy, click below and buy option 2, or go to vario.ie and buy option 2. To choose your option, either option 1 or 2, just click on the buttons below, or you can go to vario.ie and click on option 1 or 2. When we receive your payment, we will deliver your box to your home, and all you need to do is plug it in and connect it to your TV and your internet. Any problems? We're here on standby to help.